There's a very interesting statistic that we are in the lowest three vaccinated states, United States, and this last week we're in the highest three rate of infection per population. And if you look alternatively, the states that have the highest three vaccination rates of like 70% have the lowest rate of infection. There is a direct correlation right now in the communities that are unvaccinated that have deaths due to COVID compared to the communities that are highly vaccinated and their deaths due to COVID.
We as providers have heard horrible stories of people who have brought the infection to their grandparents who got the infection and died. There's a lot of regret. And so we want people to take advantage of this as soon as they can. This is not a joke. This is not a drill. Now is the time to get vaccinated.
I have patients in the hospital that come in here unvaccinated and don't leave. I have patients that come in as a couple, one leaves and one doesn't, and they're not vaccinated. Vaccination prevents this, and it's that simple. We have to get the message out to get everybody vaccinated. They have to do it soon, they have to do it now, and they have to trust that the data that the FDA has reviewed has found this safe and effective, and the alternative of COVID is not. There's nothing safe or effective about a COVID infection.
The lives we lose now are 100% avoidable if people will get the vaccine. And that's the strong message. And I think that's the challenge for our healthcare workforce is as they see people hospitalized, as they see people, in the intensive care unit, and unfortunately, as they see people not survive the intensive care unit, those are avoidable losses, not only for the healthcare workers, but for those families, our communities, and the state as a whole.
I think there's an unfortunate large amount of false information. You hear the funny stories of, people sticking to refrigerators because of the aliens that are introduced into their arms.
There's been some misinformation out there about whether it impacts fertility. It does not. It does not affect people's fertility. It doesn't make them more fertile or less fertile. It just has no impact on it.
Now, some people do have legitimate healthcare concerns of why they would not want to, that they should discuss with their primary care provider. However, this vaccine is incredibly safe. It's the most effective vaccine we've ever had. It's 95% effective. You can almost not ask for a better vaccine.
I would encourage everybody to recognize the threat, recognize the risk, not feel like you have some innate protection because your immune system has never seen this before, and to move from an unprotected group to a protected group by getting a very safe and very effective vaccine.
These vaccines, they are fabulous vaccines. They prevent 99% of deaths from COVID and 98% of hospitalizations from COVID. That's how well they work. But some people may get a mild upper respiratory infection, and in terms of getting any infection at all, they prevent COVID about 90% of the time with the Delta variant.
And the people that are coming in, are they vaccinated, unvaccinated, or a mix?
The vast majority of the cases in our hospital are unvaccinated. 98% of the hospitalizations right now are preventable with a vaccine.
I've never still had one patient admitted that I've taken care of that's been vaccinated. Yes, there are a few here and there, but overall, most are not. And my personal experience is zero. And it is heartbreaking to ask somebody, were you vaccinated? And then look me back in the eye, say no, and start crying. The regret of them now understanding the consequences of not getting vaccinated for the reasons that may or may not have been important to them at the time is heartbreaking. Asking somebody who's healthy, are you getting vaccinated, and them feeling comfortable, yes or no, is very different than asking somebody who's in the ICU with a probably 25% mortality or higher. I'm just begging every Arkansan to get vaccinated. Everybody should be vaccinated. We have to do better.